Good morning. During today's legislative hearing, we will consider 5 bills. S2385, Tribal Access to Clean Water Act of 2023. S2796, a bill to provide for the equitable settlement of certain Indian land disputes regarding land in Illinois and for other purposes. S2868, a bill to accept the request to revoke the charter of incorporation of the Lower Sioux Indian community of the state of Minnesota at the request of that community and for other purposes. S3022, the IHS Workforce Parity Act of 2023, and S3230, the Winnebago Land Transfer Act of 2023. S2385 was introduced by Senator Bennett and has 8 co-sponsors. The bill would expand access to funding provided through the infrastructure bill for clean water across Indian country. Specifically, it authorizes the U.S. Department of Agriculture to make loans and grants for technical assistance, authorize additional funding for technical assistance to existing Indian Health Service water facilities programs, and authorize funding for the Bureau of Reclamation's existing Native American Technical Assistance Program. S2796 was introduced by Senator Mullen. This bill would waive any statute of limitation and grant the United States Court of Federal Claims jurisdiction to decide a land claim by the Miami Tribe of Oklahoma arising under its 1805 Treaty of Grouse Land with the United States. The bill would also extinguish any and all other claims the tribe, its members, descendants, or predecessors in interest have to lands in Illinois and clear title to those lands. S2868 was introduced by Senators Smith and Klobuchar. Excuse me. This bill would revoke, at the request of the Lower Sioux Indian community, the tribe's corporate charter under Section 17 of the Indian Reorganization Act. S3022 was introduced by Senator Cortez Masto and Senator Mullen. This bill would permit the Indian Health Service scholarship and loan repayment assistance recipients to fulfill service obligations through half-time clinic practice. S3230 was introduced by Senator Fisher and has 3 co-sponsors. This bill would transfer approximately 1,585 acres of land currently administered by the United States Army Corps of Engineers to the Bureau of Indian Affairs to be held in trust for the Winnebago tribe of Nebraska as part of the tribe's reservation. The bill would prohibit gaming activities on these lands under the Indian Gaming Regulatory Act. Before I turn to the Vice Chair for her opening statement, I'd like to extend my welcome and thanks to our witnesses for joining us today. I look forward to your testimony and our discussion. And just for the audience and the panelists' information, there are, I think, 7 hearings happening at the exact same time and a Republican caucus meeting, which I'm sure is going smoothly. So I think now I will recognize Senator Cortez Masto to introduce her witness. Senator Cortez Masto.
Thank you, Chairman. I am so pleased to be introducing Angie Wilson. Angie serves as the Tribal Health Director for the Reno Sparks Indian Colony in Reno, Nevada. It is the largest tribal health clinic in my state, having served more than 6,000 American Indians and Alaska Natives. Ms. Wilson is an enrolled member of the Pitt River Tribe of Northern California and Klamath descendant of the Klamath Tribe of Southern Oregon. Ms. Wilson's career spanned nearly 30 years in tribal health administration. Apart from her directorship, she serves several tribal delegations, including the National CMS Tribal Technical Advisory Group, the California Area IHS Tribal Advisory Committee, and the Pitt River Tribal Health Service Board of Directors. Over her career, Ms. Wilson has directed multi-award-winning tribal health clinic and has received recognition from the National Indian Health Board for her significant work in advocacy to strengthen quality healthcare initiatives and sustainability methodologies for American Indian and Alaskan Native communities. I welcome Angie to this committee and the hearing today. Thank you, Mr. Chair.
Thank you, Senator Cortez Masto. And Senator Smith, are you ready to introduce your witness? I know you just sat down, so I didn't want to jam you up.
No, I think I am ready, Mr. Chair. Thank you very much. It's one of those mornings, right?
I understand. If you want me to stall for 30 seconds, I'd be pleased to do so.
Good morning. I want to thank Chair Schatz and Vice Chair Murkowski for holding this hearing today, and also for including my bill to revoke the corporate charter of the Lower Sioux Indian community at the request of the tribe. And I also want to welcome President Larson, Deuce Larson of Lower Sioux to the committee. Deuce has served on the council for over a decade and is a tremendous leader for the tribe. I'm honored to call Deuce my friend as well as my colleague, and I'm very grateful that he's with us here today to discuss the importance of this bill to the Lower Sioux. Mr. Chair, you know that the Indian Reorganization Act of 1934 set about a new era of federal Indian policy, one that allowed for self-determination and government-to-government relationships between tribal nations and the federal government. And it also created these paternalistic and burdensome corporate charters under which tribes would theoretically be able to conduct their business activities. And for Lower Sioux, this corporate charter limits transactions that they can make to $1,000 without the direct consent of the Secretary of the Interior. So $1,000 or you got to go to the Secretary of the Interior. It limits lease terms, corporate income, and prohibits the sale of land held by the corporation. So the charter is outdated, and Lower Sioux is asking Congress to revoke it, and that is the purpose of the bill that we have here. So I am grateful for the opportunity to have a hearing on this bill, and I welcome Deuce to the committee, and welcome to all of our panelists here today. It's great to be with you. Thank you.
Thank you, Senator Smith, and we'll now recognize the Vice Chair for her opening statement.
Thank you, Mr. Chairman. My apologies for being late. We're bouncing in between 3 different hearings and a caucus meeting all this morning, so it's a busy day. But thank you and welcome to our witnesses. Appreciate you being here and the contribution you will provide to the committee. I'm going to keep my comments brief, as I know members will be speaking about their bills. But I am pleased that this is a good range of issues that we have before the committee today, everything from promoting tribal economic development to hiring and retaining doctors at IHS to restoring tribal lands and settling outstanding tribal land claims. We also have legislation aimed at expanding access to water in Indian country. And I would just like to make a couple short comments because I have raised it so often in this committee about the significance, the importance, the responsibility to deliver clean, affordable water to our Native communities. IHS estimates that 1 in 10 Native Americans lacks access to water or indoor plumbing. This is 2024. And so to know that that statistic is still one that so many are living with is really very troubling. I come from a place where we have families that have to haul or barge in their water. Some cases, river water is the only option, and as clean as we might want to think that is, it doesn't meet your federal water quality standards, but it is truly one of our great public health challenges in rural Alaska and in so many parts of the country as well. We have made some progress through the bipartisan infrastructure law in clearing the backlog of water and sanitation projects at IHS. Communities that have waited for decades to get piped water and sewer are finally getting connected. That's great. We had a hearing in September on the trust responsibility of providing for water and sanitation needs for those in our Native communities. And again, a recognition that the need is great and there is so much more that remains to be done. It's not only the construction side of it, but it's also the operation and the maintenance. And so the federal investment that is made as we seek to meet our trust obligations, I think is so important. We have launched a GAO study to examine the operation and maintenance issue in greater detail, but I think it's pretty clear that the federal government has to start working with tribes now to address O&M before costs begin to compound in the coming years. So a lot to be done in that space, and I think the opportunity that we have with leadership that is before the committee now to help us address some of these challenges, raise them to the level of the legislation that's being considered today, and then move to improve outcomes is good. So thank you for the opportunity, Mr. Chairman.
Thank you very much, Vice Chair Murkowski. And now we will introduce the remainder of our panel. I'll start with the Honorable Melanie Ann Egerin, the Assistant Secretary for Legislation, Health and Human Services at Health and Human Services. Ms. Catherine Isom Claus, the Deputy Assistant Secretary of Indian Affairs at the Department of Interior. The Honorable Manuel Hart, the President of the Ute Mountain Tribe in Colorado. Welcome. The Honorable Douglas Langford, Chief of the Miami Tribe of Oklahoma, Miami, Oklahoma. Thank you. The Honorable Victoria Kitcheyan, the Chairwoman of the Winnebago Tribe of Nebraska, Winnebago. We appreciate you being here. And I will remind all of our witnesses that we have your full written testimony. Did I miss somebody? Yeah, they were introduced by the members, yes. I want to remind our witnesses that you have we have your full written testimony. I'll be all right. We have your full written testimony, and please keep it within 5 minutes so that we have time for questions. And I'll start with Ms. Egerin. Please proceed with your testimony.
Good afternoon, Chairman Schatz, Vice Chair Murkowski, members of the committee. Thank you for the opportunity to provide testimony on two important legislative proposals and for your continued support of the Department of Health and Human Services efforts to improve health and well-being for American Indians and Alaska Natives. Your consideration today of Senator Cortez Masto's Indian Health Service Workforce Parity Act and Senator Bennett's Tribal Access to Clean Water Act underscores the commitment to improving the quality of life in Indian country. I'm Melanie Ann Egerin, the Assistant Secretary for Legislation at HHS. My office serves as the primary link between the department and Congress, providing technical assistance on legislation, facilitating informational briefings related to department programs, and supporting the implementation of legislation passed by Congress. The department has been pleased to collaborate with Congress and this committee to investigate the many challenges facing Indian country. HHS remains committed to working with Congress to improve the health for tribal and Native communities, including finding solutions related to clean water access and IHS workforce shortages. The IHS, as a rural healthcare provider, experiences difficulty recruiting and retaining healthcare professionals. In particular, recruiting physicians and other primary care clinicians has been especially challenging. There are over 1,800 current vacancies at HHS. Staffing shortages are particularly prevalent in the behavioral and mental health fields, which has only exacerbated the substance use crisis and suicide crisis that tribes across the country are facing in their communities. Workforce challenges and the impacts on care that come from them are one of the top concerns raised to the department by tribes. My staff and I have heard firsthand during our visits to the Ogallala Sioux tribe on the Pine Ridge Reservation in South Dakota and the Blackfeet tribe in Montana. The Blackfeet tribe shared that workforce shortages of over 40% at their hospitals and clinics greatly impacts the accessibility and quality of health care in their rural community. These experiences have been echoed by other tribes across the nation to IHS, particularly during tribal consultation. The IHS continues to support new strategies to develop workforce and leverage advanced practice providers and paraprofessionals to improve the access and quality of healthcare in tribal communities. And ultimately, the Indian Health Service needs additional authorities and resources to build our workforce pathway. That's why the President's budget has included a number of proposals that has sought to make IHS more competitive with other federal agencies in our hiring process and reduce systemic barriers to recruitment and retention. The IHS Workforce Parity Act would allow recipients of IHS scholarships and loan programs to fulfill their service obligations through half-time clinical practice. This bill is certainly aligned with the goals of IHS in many respects. The President's budget includes a similar proposal that permits both IHS scholarships and loan repayment recipients to fulfill service obligations through half-time clinical practice over an extended period of time. This would increase the ability of IHS to recruit and retain healthcare clinicians and to provide primary care health and specialty services. This is one of many proposals in the President's budget that are budget neutral, small fixes that have major impacts in the efficacy and quality of IHS. Specifically, IHS also seeks tax exemption for their health professional scholarship and loan repayment programs. Exempting this program would allow IHS to support an additional 190 providers in a given year. The agency is seeking discretionary use of all Title 38 personnel flexibilities to help pay higher salaries and offer more flexible time off to providers, permanent authority to hire and pay experts and consultants that would combat future pandemics and emergencies and unique healthcare challenges by providing additional high-level resources to IHS unavailable in the current workforce. The agency is also seeking legislative authority to conduct mission-critical emergency hiring beyond 30-day appointments to fill key positions. I want to reiterate that the Biden-Harris administration agrees that water is a sacred resource and must be protected. The administration and HHS have worked hard to begin to address decades of chronic underinvestment in infrastructure for tribal and Native communities. The bipartisan efforts of Congress, including many champions in this room, have helped to ensure critical funds for clean drinking water and modern wastewater and sanitation systems were included in the Infrastructure Investment and Jobs Act. We are committed to ensure that these historic funds are implemented successfully and that the dollars reach Indian country as quickly as possible. That being said, too many tribal families still do not have access to clean water and reliable wastewater infrastructure. The Tribal Access to Clean Water Act aims to help expand HHS's role in providing access to reliable and clean water on tribal lands. HHS is still currently reviewing the language and implications of this bill, but that said, the department would like to continue to work with the bill sponsors and committee to ensure compatibility with existing sanitation facility authorities and determine the best way to serve non-eligible homes and commercial properties located within tribal communities. Thank you again for the opportunity to testify today. Thank you, Senators Cortez Masto and Bennett, who have led these legislative efforts to fix systemic challenges in Indian country. We look forward to continuing our work with Congress on these bills. As always, HHS is committed to working closely with tribal communities and our external partners and understand the importance of working together to address the needs of American Indians and Alaska Natives.
Thank you very much. Ms. Isom-Claus, please proceed.
Thank you. Good morning, Chairman Schatz, Vice Chairman Murkowski, and members of the committee. My name is Catherine Isom-Claus. I'm Taos Pueblo, and I'm the Deputy Assistant Secretary for Policy and Economic Development for Indian Affairs at the Department of the Interior. Thank you for the opportunity to present testimony on 4 bills before the committee today. The Biden administration recognizes that water is essential for people to lead healthy, safe, and fulfilling lives on tribal lands. Water is among the most sacred and valuable resources for tribal nations. The Tribal Access to Clean Water Act of 2023 seeks to help fund water infrastructure projects in tribal communities by increasing federal funding, including $90 million over 5 years for the Bureau of Reclamation's Native American Affairs Technical Assistance Program, or TAP. TAP provides technical assistance to tribes to develop, manage, and protect their water and related resources. The program has supported a broad range of activities, including water needs assessments, improved water management studies, water quality data collection and assessments, and water measurement studies. Work under TAP is carried out in different ways, sometimes by reclamation under cooperative agreements, working relationships with tribes. Other times, tribes carry out the work themselves. Alternatively, reclamation may provide training to enhance tribal members' knowledge and expertise in the use, protection, and development of water resources. The department is committed to further developing this program in the coming years, including with the FY 2024 President's budget request of $23.5 million. We appreciate the interest and support of the sponsors of S2385 and TAP, and as partners in efforts to address the longstanding water crises that continue to undermine public health and economic development in Indian country. Next up is S2868. The Lower Sioux Indian Community is a federally recognized Indian tribe organized under a constitution and bylaws adopted by the community's membership in 1936, pursuant to Section 16 of the Indian Reorganization Act, or IRA. In 1937, the community was issued and ratified a corporate charter pursuant to Section 17 of the IRA. In a November 2021 resolution, the community stated that it has not used the charter since ratification in 1937 and it serves no function. The IRA requires that any charter so issued shall not be revoked or surrendered except by act of Congress. S2868, at the request of the community, would revoke the charter. Consistent with the administration's support for tribal self-determination and self-governance, the department believes that the decision whether to maintain or revoke such a charter should ultimately be the community's, and therefore supports S2868. S2796 would confer jurisdiction to the United States Court of Federal Claims to hear, determine, and render judgment regarding the Miami Tribe of Oklahoma's land claims under the Treaty of Grouseland. and would remove legal or equitable defenses based on the passage of time, including statute of limitations. The jurisdiction conferred to the United States Court of Federal Claims expires unless a claim is filed under paragraph 1 of S 2796 by the tribe within 1 year of enactment of the legislation. The bill extinguishes all other claims to title of the Miami Tribe of Oklahoma or any member, descendant, or predecessor in interest to the Miami Tribe of Oklahoma to land in the state of Illinois. The department needs to better understand the claims by the Miami Tribe of Oklahoma and the impacts of this legislation on those claims and any remedy sought by the tribe. The department therefore takes no position on the legislation at this time. And finally, S 3230, the Winnebago Reservation, was established by the Treaty of March 8, 1865, in exchange for cession of the Winnebago's tribe's lands in the Dakota Territory. However, in the 1970s, the tracts identified in S 3230 were acquired by the U.S. Army Corps of Engineers. S 3230 would transfer the identified lands from the Army Corps of Engineers to the United States to be held in trust for the benefit of the Winnebago tribe. The Department of the Interior supports S 3230. This bill is in line with the administration's commitment to honor treaty rights, respect tribal sovereignty, and support the right of tribal governments to acquire land in trust in furtherance of their self-determination. Chairman Schatz, Vice Chairman Murkowski, members of the committee, thank you for the opportunity to provide the department's views.
Thank you very much. Chairman Hart, welcome, and please proceed with your testimony.
Thank you, Chairman Schatz. On behalf of the Ute Mountain Ute Tribe, thank you for the opportunity to provide testimony on Senate Bill 2385, Tribal Access to Clean Water Act of 2023. One of the most significant issues facing the tribe today is access to reliable, clean drinking water. Without reliable, clean drinking water, the Ute Mountain Ute people cannot sustain their sovereign right to self-sufficiency and to self-government. The funding made available through the Tribal Access to Clean Water Act of 2023 is crucial to ensuring the tribe has access to reliable, clean drinking water and is necessary first step to meeting with the United States the treaty obligation and trust responsibility to Ute Mountain Ute people. Despite our tribe's contemporary success in developing irrigation systems and award-winning farming operations, it is still the case 101 years after making these comments that the Ute Mountain Ute people remain without federal support for adequate supply of water. I am here today to remind the United States of its obligations once again to the Ute Mountain Ute people and to collect on the promise made long ago to Chief Ignacio and all the Ute Mountain Utes. The Ute Mountain Utes' sovereign lands are in the states of Colorado, New Mexico, and Utah, magnifying the issues of access to clean water threefold. The tribe faces unique issues related to access of a reliable clean water source of drinking water on its reservation lands in each of the states. I'd like to address two of the states. Access to clean water in Utah and in Colorado. Although the three negotiations and settlement claims for its federal reserve rights in Colorado in 2000, the tribe remains unable to access critical water resources due to lack of water infrastructure. 24 years later, as you may know, the Colorado Ute Settlement Act of 2000 guaranteed the Ute people 16,525 acres feet of water from the Animas La Plata project ALP at Lake Nighthorse. However, year after year, the tribe has been unable to access its water due to the lack of water infrastructure connecting the ALP project to the tribe's reservation lands. Although the tribe has spent significant time and resources to develop access to its water in ALP, the tribe cannot do without financial assistance from the federal government. The funding that would be able to be available as part of Senate Bill 2385, both for technical assistance and for the development, use and control of water, and the installation of essential community facilities and necessary related equipment is crucial for the advancement for the federal government's treaty obligation as trust responsibility to Ute Mountain Ute people. Today we have 16,000 acre feet of water that we have no access to and that we have no infrastructure in place, and we are not even compensated for it, yet it sits there decade after decade. Access to clean water in Utah. Access to reliable, clean drinking water is a concern for all the tribe's lands, but perhaps none more so than in Utah. As previously mentioned, the tribe has non-contiguous reservation lands in southeastern Utah separate from its reservation lands in southwestern Colorado and New Mexico. White Mesa is the primary tribal community in the Utah portion of the tribe's lands. The tribe and individual tribal citizens also hold trust allotment lands located west and east of White Mesa along Cottonwood Canyon. The current source of water for the majority of the use for the White Mesa community is a deep water aquifer. The White Mesa Uranium Mill is located approximately 2.5 miles north of the White Mesa tribal community. It is the only conventional uranium mill still in operation in the United States. The tribe and its tribal citizens are very concerned about the potential for the mill to infiltrate, to contaminate the aquifers relied upon the tribe for its very water supply. The tribe has spent significant funds to build a water treatment and testing facilities in White Mesa. However, the tribal community is afraid of drinking contaminated water, and no one will consume it. Presently, the tribe is in discussion with the state engineer of Utah on settling the tribe's water rights in White Mesa. Water quality issues will be a key piece of those discussions, and to ensure access to clean water, drinking water, is part of those negotiations. A federal presence in those discussions, including the EPA, is critical to ensure access to clean water for White Mesa and all the Ute Mountain Ute tribal communities. In addition to resources devoted to settling the tribe's water rights, access to technical assistance, funding under Senate Bill 2385 would help ensure unique issues at White Mesa are adequately addressed. We have concerns, and we're asking for an epidemiology study from the IHS for the Albuquerque region area and also with the state of Utah. Thank you for your consideration of this testimony. We look forward to our continued work with you to enact legislation to support tribal access to reliable, clean drinking water on the Ute Mountain Ute Reservation lands in Utah, Colorado, and New Mexico. Respectfully submitted, Ute Mountain Ute Tribal Chairman Manuel Hart. Thank you.
Thank you very much. Before we move on, if Senator Bennett is ready, I'm going to defer to Senator Bennett just so that it makes sense that we do states in the adjacent to each other, and then I will recognize Senator Mullen for his witness and Senator Fisher for hers. So without further ado, Senator Bennett.
Thank you, Mr. Chairman. That's very kind of you, and I know the schedule is moving around here, but I'm very glad I had the opportunity to be here for Chairman Hart's testimony. I think, and I'm deeply, deeply grateful that he's here today. He's served on the Ute Mountain Ute Council since 1995. He's been chairman for 14 years. His leadership has meant a lot, not just to the Ute Mountain Ute, but to all of Colorado and to the West. And the work that he's done on water and on public lands has been incredibly important. And he's done it all while he's been a cattle rancher at the same time. So I just want to say I've had the benefit of his leadership. And today the country has the benefit of his leadership. Today, only half of households on Native American reservations have clean water or adequate sanitation, and I know the chairman knows these issues well. Tribal households are nearly 20 times more likely than white households to lack indoor plumbing. And Chairman Hart has told me that it is customary in the White Mesa community to bring bottled water as a greeting gift because water contamination remains a profound challenge. And Mr. Chair, the status quo is completely unacceptable to me, and it should be unacceptable to every member of the United States Senate. No family in this country should have to raise their children without clean water. No member of a tribe should have to accept circumstances none of us would accept for our own family. And this hardship is particularly egregious because it is a direct consequence of the federal government's failure to honor promises and treaties made to tribes across this land. I think that if any of us faced the challenges that the tribal leaders are facing today and that their membership is facing today when it comes to clean water for their families and for their kids, none of us would stay here in Washington, D.C. We would all go home to make sure that clean water was being provided. And that's why this leadership is here today. A few years ago, we took big steps forward to secure clean water for tribes in the bipartisan infrastructure law, including by providing the Indian Health Service with $3.5 billion for their sanitation deficiency list, and the Bureau of Reclamation with $1 billion for rural water supply projects. But the Ute Mountain Ute tribe and other tribes have struggled to access this funding because their projects require planning and other pre-construction work before being considered shovel-ready by the government. The Tribal Access to Clean Water Act addresses these challenges by authorizing critical technical assistance at the Indian Health Service, the Department of Agriculture, the Bureau of Reclamation for tribes, to receive support for project planning and design and take full advantage of bipartisan law funding. This bill would help the Ute Mountain Ute tribe replace 15 miles of 30-year-old iron water lines which service the growing Toyac community, but which regularly break. This bill is broadly supported across Native communities, and I brought letters of support from more than 20 members of the Clean Water for All Coalition, including the Navajo Nation, National Congress of American Indians, Vessel, and Dig Deep. And I'd ask unanimous consent, Mr. Chairman, that we'd enter these into the record.
Without objection.
Mr. Chair, thank you. Just to close, when the federal government established reservations for Native American tribes, it promised a permanent and livable homeland for those it had displaced from their ancestral lands. When access to clean and safe water, a human right, is being denied, this promise clearly has been betrayed. This promise clearly has been denied. With this bill, we have an opportunity to ensure more Native communities have access to clean water the same way every senator does and every senator's family does. And I welcome the committee's feedback on how to improve this legislation so we can ensure Native Hawaiians and Alaska Natives and tribes across the country can access bipartisan infrastructure law funds to guarantee reliable access to clean water. And I hope that once you've had the opportunity to look at this bill, it will earn a strong bipartisan vote from this committee. And I thank you all for your leadership and for giving me the opportunity to be here today.
Thank you very much, Senator Bennett. Senator Mullen.
Thank you, Mr. Chairman. I do apologize about coming in late, and I apologize for having to leave too, because as Mr. Bennett referred to, our schedules are changing a lot right now today, and all of us is kind of up in the air. I do want to say real quickly, though, thank you for having this hearing today on Senate Bill 3022, IHS workforce. All of us that live or like I do in Indian country or work for Indian country understands that's a huge need. I've mentioned it multiple times. I grew up without insurance because we had Indian Health Services. Hastings, which is Tahlequah Hospital, was for Cherokee Nation was the healthcare place, and so the workforce need is real, and it's a dire strait. So I appreciate you hearing that. And then also Senate Bill 2796, which is the Miami, Illinois Land Claim Settlement Act, which is what I have worked with my good friend. I mean, I say really good friend. I mean that because when we first met, Chief, you had a full head of hair and he's built like a warrior. That's quite the opposite now, sir. But you're working on it. I get that. But Chief Langford and I go way back. The only hit I have on him is that, and you guys can't really judge him on this. I do. But he went to school in Missouri, and so. But I understand where the Miami tribe is. It's right on the line, so it's close enough that we'll accept him. But just to give you kind of a little background, Chief Langford, he has served the Miami tribe since 2008, both as second chief and chief since 2013. Chief Langford directs the tribe's government affairs of the federal, state, and intertribal levels. He's responsible for management and oversight of the multi-million-dollar budget for various federal grants and tribal entities. Sadly, as I said before, he went to school in Missouri, but I think we all claim he is in Oklahoma now, and you have worked tirelessly up in Ottawa County for not just your tribe, but for the people that live in and around your all's reservation, and it doesn't go without notice. It's something that it's a bragging point for me to see how you interact with everybody that lives and interacts inside your reservation. As I mentioned before, he is a very good friend of mine. That's why I can joke and make fun of him, and I'm sure I'll have that one coming back at some point. And just to kind of give you a brief overlay of the Miami, Illinois land claim settlement bill, this has no cost at all related to it. It's actually, if you take a look at it, it makes perfect sense, but you and I have been fighting this for years. I offered this bill up in the House. I think the first time was in 2014.
So,
And now we're here in the Senate, and I really hope we take a hard look at this and get this behind us. It's sad when you see something that makes sense and really should have no pushback. It takes years to make it right, especially inside Indian country. So, Chairman, for just allowing this to go this far so far, I just want to tell you how much I truly, truly appreciate it. And I'll speak for the chief, too. I know he really appreciates it, too. So thank you for this time.
Thank you very much, Senator Mullen. Chief Langford, please proceed with your testimony.
thank you. Aya, Akim Echapungwia, Wayneswani, Nila Miamia. I'm Chief Doug Langford of the Miami Tribe of Oklahoma, and I want to thank the committee for today for the opportunity to testify in support of S 2796. This bill resolves the tribe's land claim in East Central Illinois by doing two things. First, it gives the United States Court of Federal Claims the authority to decide whether the United States took land protected by the 1805 Treaty of Grassland without paying the tribe. And second, it extinguishes the tribe's claim to those lands, which forever eliminates clout on title for the current landowners. For 7 years, we have worked to make this bill law. In that time, we have only encountered one question: why now? In short, because time has not stood still. Our claims were not resolved during the ICC, and due to past litigation, there is a clout on title for the landowners of 2.6 million acres in East Central Illinois. The only way to clear clout on title is for Congress to extinguish our land claim. And all we are asking in exchange for 2.6 million acres of ancestral homeland is an opportunity to be heard in court. We are not asking for an outcome. We are asking for a chance to seek justice. You might ask, how did this come about? Although the Miami tribe's seat of government is in northeast Oklahoma, the tribe was forcibly removed from its ancestral homelands in Indiana, Illinois, and Ohio. In 1805, the Miami tribe signed the Treaty of Grassland. By Article 4 of that treaty, the United States agreed that it would not take additional lands in the watershed without permission and consent of the tribe. Between 1805 and 1840, the Miamis entered into several treaty ceding most of its homeland. However, 2.6 million acres located in the watershed, today East Central Illinois, were never ceded to the United States. Despite lacking title, the United States sold the reserve land to non-Indian settlers, giving rise to the Miami claim and creating a clout on title on these lands. S 2796 represents a common sense, mutually beneficial resolution to this problem. It is based on the legislation introduced by the Illinois delegation in 2001, H.R. 791 and S 533. That legislation was widely supported as common sense approach, and so is our bill. S 2796, which enjoyed bipartisan support throughout its life, would extinguish the tribe's land claim, resolving the clout on title, and grant the tribe 1 year to bring its case before the United States Court of Federal Claims. To be clear, the passage of this legislation extinguishes the Miami land claim and the clout on title is cleared, regardless of the tribe's outcome in litigating its claim before the court. When the tribe asked Congressman Don Young to co-sponsor the bill years ago, he looked me in the eye and said, so the landowners get resolved, the tribe still has to prove its case. Are you sure that's what you want? And I said, yes, sir, it is. And he said, fair enough. Congressman Young was a straight shooter and a tireless advocate for Indian country. He understood the common sense of the bill right away. The tribe has worked closely and diligently with the congressional leadership and local leaders from Illinois, especially those in the affected treaty area. And the Illinois Farm Bureau supports this legislation. Finally, please note this bill is not a land claim settlement bill or an appropriation bill. If the tribe prevails in court, its judgment would be paid from the Federal Judgment Fund. Also, this bill does not decide the merits or defenses and does not declare any winners except the landowners in East Central Illinois. Ms. Shanawe, thank you, Mr. Chairman and committee members, for your time and the opportunity to testify in support of this bill. I have to say a special thank you to Senator Mullen for his many years of advocating for this bill. And I also want to thank Senator Durbin for his time and attention he has given to this matter. I'm happy to answer any questions the committee may have.
Thank you very much, Chief Mayama. And by the way, for any member, any staff, any testifier, I take pronunciation very seriously because I come from Hawaii and also because my last name is Schatz. And so we try very hard to get it right. So please help us with phonetics and whispering in my ear. I do consider it a serious sign of respect when you get it right, and accidental in this case, disrespect when you get it wrong. So
Did you say shots?
Shot, see? Shots or Schwartz, whatever you want.
Yeah, shots. That's a lot easier. I can pronounce that.
Senator Fisher.
Thank you, Chairman Schatz. It is great to be back before this committee again. Today it is my honor to introduce the chairwoman of the Winnebago Tribe of Nebraska, Victoria Kitcheyan, to testify in support of the Winnebago Land Transfer Act. I am grateful that the bill passed the House of Representatives just this week, and I'm hopeful that we can soon follow here in the Senate. Chairwoman Kitcheyan has been serving in her current role for the Winnebago Tribe since 2020. But for years before her election as chairwoman, she dedicated herself to the welfare and prosperity of her tribe. Chairwoman Kitcheyan was first elected to the Winnebago Tribal Council nearly a decade ago. She is the former chairwoman of the National Indian Health Board, and she has served on the board's Medicare, Medicaid, and Health Reform Policy Committee. She's also served on the Secretary's Tribal Advisory Committee at the Department of Health and Human Services. Chairwoman Kitcheyan has demonstrated unwavering devotion to her tribe and a comprehensive understanding of the issues that they face. There's no more knowledgeable or committed individual who could testify here today. My colleagues and I introduced the Winnebago Land Transfer Act last year to respond to the trials this tribe has faced over decades, trials imposed, sadly, by our own government. The Winnebago tribe endured forced removal from their homeland in the mid-1800s. They settled in the Winnebago Indian Reservation in Nebraska in 1865. The government promised the Winnebago tribe that land in my home state, and they promised it forever. But in 1970, the U.S. Army Corps of Engineers condemned approximately 1,600 acres of the tribe's reservation land for a proposed recreation project, a project that was never started. What ensued was over half a century of legal battles between the Winnebago tribe and the U.S. government, battles that never brought this matter to a just resolution. Our bill would restore the tribe's rightful land, transferring the outstanding tracts of land back from the Army Corps. The Corps no longer objects to returning the land, but this legislation is needed to actually get it transferred to the tribe. I'm optimistic that we can continue raising bipartisan, bicameral support for this bill, and that we can send it to the President's desk. Thank you, Madam Chairwoman, for being here today. It is an honor to have you, and thank you, Chairman Schatz.
Senator Smith and Chairman Larson, with your indulgence, we're going to try to keep the member with the relevant testifier together just so we're not confusing ourselves. So, Chairwoman Kitcheyan, please proceed with your testimony.
Good morning, Chairman Schatz, Vice Chair Murkowski, and members of the subcommittee. My name is Victoria Kitcheyan, and I have the honor of serving as the chairwoman of the Winnebago Tribe of Nebraska. Thank you for holding this hearing on S-3230, the Winnebago Land Transfer Act. I'd like to begin by expressing my heartfelt gratitude towards Senator Fisher, Ricketts, Grassley, and Ernst for their leadership in championing this bill. Senator Fisher, it's been my honor to work with you, and the kind introduction was so nice. And the sheer determination that you've shown in helping us get this legislation passed. And the elders at home told us of a lady out east that was going to help us. and the leadership that you've demonstrated. Our delegation believes that you're that lady. So thank you for being an answered prayer to the Winnebago people. Honorable members of the subcommittee, you have my written testimony. I want to use this time to tell you about the historic and meaningful week our delegation has had. On Monday, the Winnebago delegation was in the gallery when the House passed our bill by a voice vote. It was an emotional experience to hear the tribe's name and the introduction of that bill, and it was a milestone and a historic moment in the tribe's work. On Tuesday, we were able to visit the archives and look at our 11 treaties, among them the 1865 treaty that established our reservation and that would be our home forever. And getting to have this humbling experience to see the markings of the warriors, Chief Little Priest, Chief Whirling Thunder, and the bravery and the respect and the diplomacy that they exhibited in establishing the federal government, the government-to-government relationship. And it was that bravery and that respect and that carries over to our tribal council and our responsibility to uphold those treaties. And that exercise was significant in creating that space for change. The ancestors were with us. That afternoon, we went to the Smithsonian's Cultural Resource Center, and we were able to view our relatives' items that they left behind. And it was by no coincidence that our delegations were represented, the families and the clans that were there that day. And being in the presence and get to look at the beauty and take in the spirit of those items was powerful. And it was the designs and the materials used in those items that are still in our families and in our community today and are celebrated as a remembrance of and who we are. It was this intrinsic tie to the land in our everyday life and our culture. And it also demonstrates the depth of our relationship with Mauna's creation. The ancestors are with us. Yesterday, we had an amazing visit with Senator Fisher and many other the committee's staff. And we were able to discuss this bill and talk about how important this was to the tribe. And here we are today amongst this distinguished body and recognizing the work that's been brought before you and what strong advocates you are for Indian country. I share these moments because I want you to know how meaningful this has been to us and the significance of returning this land. Our Winnebago delegation is here carrying the work forward of others, most notably the late Louis LaRose Wanagita was the chairman in the 1970s, and he served over a span of 50 years. And he was the chairman when this land was taken, and it was my honor to get to sit at the table with him. And sadly, he passed the day after the Senate introduced our bill. So we're here to continue Louis' work. We're here to finish this on behalf of the people. And once this land is restored, we plan to keep this land in conservation, and our Wildlife and Parks Department has the capacity and resources to manage this land for recreation and conservation activities. And the tribe has no intention of making any changes to those conservation efforts by the Army Corps or the Iowa DNR. In conclusion, I want to share some teachings of the Winnebago people. The elders tell us it's really simple. They say, love one another, take care of one another, be good to one another. So I want to ask this committee to be good to the Winnebago people. Our people say, Aikido di. Stand arm in arm. And I say Aikido di to this committee and ask you to stand arm in arm with the Winnebago people and pass S3230. Wanagi Napshna.
Thank you very much, Chairwoman. And now the Honorable Robert Larson, the President of the Lower Sioux Indian Community in Minnesota. Chairman. President.
Ahamitakiapi. Hello, my relatives. Dakota ya Tatanka Ikchap Tang Tamiado. In English, ya Robert Larson, her deuce. Chanshayape Itancha Demie Damakota. Introduce myself with my Dakota name and my English name. I am the president at Lower Sioux. I have that great honor to serve them. And just want to say thank you to Chair Schatz, Vice Chair Murkowski, and the committee for the opportunity to present testimony in support of Senate Bill 2868, to accept the request to revoke the charter of the incorporation of the Lower Sioux Indian community in the state of Minnesota. The charter was never requested by the community, and the community has never used it. It's a paternalistic document that limits the community's ability to manage its own economic affairs without Department of Interior approval. The charter is laced with restrictions from a long ago era that do not work today, and it serves no function for the community. The community voted to adopt and organize under its constitution and bylaws, and it has always operated its economic activities as a government rather than a federal corporation. The community has full constitutional authority to manage the business affairs of the community and to adopt tribal law governing the organization and operation of corporate entities, and it has done so. It can further organize corporate entities under community law, which would be better equipped to fulfill the goals of the community and to keep up with the changes in the marketplace and at the pace of business. Also, the community has passed its own limited liability company ordinance, which allows the community and individuals to organize as tribal companies and eliminates federal involvement in corporate affairs. Senate Bill 2868 is based on a well-worn path, as many IRA organized tribes that were issued charters have abandoned them by the same legislative method, including the Minnesota Chippewa tribe, the Prairie Island Indian community, Stockbridge-Munsee community of Mohican Indians, and the Miami tribe of Oklahoma. The community believes that abandoning the federal corporate charter is an effective and important statement that it's self-governing, sovereign, and is capable of operating economic activities of the community without the Department of Interior's assistance. I appreciate your support for the Senate Bill 2868, which revokes the community's charter. Pidamya, and thank you.
Thank you very much. And now we'll introduce our final testifier, Ms. Angie Wilson, the Executive Director of the Reno Sparks Indian Colony Tribal Health Center. And please proceed with your testimony online.
Waklisi, tu si gamadicha, tu sisunwi, adukia tu adachi. Greetings and good morning to everyone. And before I begin, I'd like to acknowledge all of the tribal leaders in the room and your powerful testimony on behalf of your tribal communities. It's beautiful to hear. Chairman Schatz, Vice Chair Murkowski, and members of the Senate Committee on Indian Affairs, I want to thank you for inviting me to speak with you all today. My name is Angie Wilson, and I serve as the Executive Director for the Reno Sparks Tribal Health Center for the Reno Sparks Indian Colony here in Northern Nevada. I'm a citizen of the Pitt River Tribe of Northern California and a Klamath Modoc descendant of the Klamath Tribes of Southern Oregon, and it's an honor to be here today. First, I'd like to express my sincere gratitude for the opportunity to testify before the Senate Committee on Indian Affairs in support of the bipartisan bill to expand the Indian Health Service Loan Repayment Program to part-time healthcare professionals. And I'd like to thank our United States Senator Catherine Cortez Masto and United States Senator Marqueen Mullen from Oklahoma on their collaboration to propose this bipartisan bill. Sepkecha, thank you for your dedication to this effort. It should be no surprise to any one of us here today in our respective positions as United States senators, health policy experts, or tribal health advocates that the healthcare for our Indian people lags that of other Americans, despite the legal obligation of the United States to provide healthcare to American Indians and Alaska Natives as a trust responsibility. As evidenced in well-documented health disparities, the health outcomes of our Indian people should be the report card for how well the trust responsibility is being upheld. In addition to decades-long underfunding, there are additional barriers that further compound inadequate access to care for our Indian people. And one key factor in many of our Indian health, tribal, and urban Indian programs is the shortage of healthcare personnel. This is especially true for our rural and frontier-based tribal reservations. As detailed in the effort on this bipartisan bill, the Indian Health Services holds a provider vacancy rate at over 25%. And while that number may seem staggering to some, The reality is that the vacancy rates are much higher in our tribal clinics and especially severe in rural and frontier-based tribal communities. I work closely with Nevada tribal health directors, and here we have 17 counties, 3 being rural, and 11 of those are frontier, with a vacancy rate as high as 50% in some of our tribal clinics. The impact of such vacancies result in our most vulnerable clinics having to use locums at such a high cost that it almost feels impossible for us to get ahead of this situation. In addition, the ability of our tribes to engage with the Indian Health Services to buy backup providers is left unresolved as their vacancy rates with IHS leave little fulfillment of the staffing needs at the local tribal level. Our Indian people continue to die at higher rates than other Americans in many categories of preventable illness, including chronic liver disease and cirrhosis, diabetes, and chronic lower respiratory diseases. This month, my extended family has lost the 6th person to cirrhosis, all of which were under 34 years old. While an additional family member is struggling to endure dialysis while waiting for a kidney transplant. So it's important that we look at this issue through the eyes of our patients, including but not limited to our members with chronic health conditions, our elders with geriatric healthcare needs, and the overwhelming need for behavioral health services within our tribal communities. Having a regular, reliable relationship with a healthcare provider is strongly associated with more use of preventative care, lower healthcare costs, and better healthcare outcomes. And this is especially true for our elder populations and reduced risk preventable hospitalizations. The Reno Sparks Health Center currently employs recipients of the IHS loan repayment program, and this bill would help to support our efforts to extend loan repayment options to part-time employees, allowing improved opportunities for staffing to better meet the needs in our tribal healthcare delivery systems. Currently, this allowance would improve our opportunities to offer part-time employment for expanded access to care, such as psychiatric nurse practitioners, practitioners in women's health, pediatrics, psychologists, and physical therapy. This allows our clinics to better utilize our space and schedule various providers throughout the week, while also extending services through our mobile medical, dental, and behavioral health units to the extended tribal community. On behalf of the Reno Sparks Indian Colony and our Tribal Health Center, we are in full support of this important bill and further advocate that loan repayment funds should be exempt from the federal income and employment taxes in alignment with loan repayment programs of the National Health Service Corps. And just real close in closing, I just want to express my gratitude to the entire Senate committee for your continued work in Indian country and urge you the importance of upholding the federal trust responsibility to our Indian people because our lives depend on it. Thank you for having me.
Thank you very much. Senator Cortez Masto.
Thank you. I want to thank Chairman and Ranking Member for holding this hearing on several important pieces of legislation that have a positive impact on Indian country. I also thank them for pulling up the IHS Workforce Parity Act. It is a piece of legislation that Senator Mullen and I have worked on together after talking with our tribes and understanding that too many tribal members can't access the health care they need because of a dire doctor shortage in Indian country. So we need to make it easier, as we've heard today from our incredible panelists. That's why this legislation would allow healthcare providers working part-time to access IHS scholarship and loan repayment programs. And you've heard why this is so important. And so let me start with Ms. Wilson. Angie, thank you again for participating virtually here. Thank you for explaining really the workforce shortages in Indian country, what you're actually seeing on the ground and the impact it is having to so many members of our tribal community. But can you also talk about, particularly in our rural healthcare areas, quite often, because there's a limited amount of healthcare workers, when we do get them in Indian country or rural areas, they are actually wearing different hats. They don't just wear one hat, right? There's different things that they are doing because that flexibility is important. And whether it's full-time or part-time, the clinical hour requirements really increase staff time for our capacity. So why is this bill that important? And Angie, let me start with you. And please address the flexibility piece of it. And the many hats that somebody, and even working part-time, will have that benefits Indian country.
Well, I think that, here, especially in our state, we're primarily a rural state, and access to healthcare providers is somewhat, challenging for us. And I would say, especially when we look at things like behavioral health, there's been often times where we get one psychiatrist that one tribe may find that all of us see if we can do a contract with that person, even for just one day or just to meet the need in our tribal clinics. And so it's somewhat in a dire situation. And when people wear multiple hats, it diminishes the amount of time that we really get with our patients. And I think that when we look at the health disparities of American Indians and Alaska Natives, there's really no time for that. We need help on the ground. We have more infant mortality rates that are off the charts compared to non-Hispanic whites, mothers who have almost 3 times less likely to receive late or no prenatal care. We don't have access to some of the urgent care needs that we have in our communities. So by being able to pass a bill that would allow the flexibility of onboarding part-timers and extending them benefits for loan repayment, it really helps us in our clinics to be able to strategize access to care in a more convenient way for our patients and be able to allow us to schedule them appropriately to be able to utilize their skills for what we need them there for.
Thank you. And let me jump to the Assistant Secretary, Ms. Egeron. Is that right?
It's Egoran.
Egoran. Thank you very much. Thank you. Ms. Egoran, thank you for the support of this piece of legislation, the Workforce Parity Act. Can you talk a little bit about how it would help build the workforce pipeline in Indian country?
Yes, thank you for that question, Senator. And I want to thank Ms. Smith. She actually met with the secretary when he was out in the district and talked about these issues and the need for support and increased capacity in our tribal healthcare. So this bill would allow the flexibility you were just talking about, whether that's being able to recruit healthcare providers who want to serve tribal communities, but also have family or other obligations to be able to split their time, or for true rural communities that may not have full capacity, may not need somebody 40 hours a week, to be able to utilize their clinical time as well as administrative time or other time to serve that community. So it builds capacity. It also, we've seen, builds the ability to recruit people and retain people, which is of critical need.
Right. Thank you. I thank you to all the panelists. Thank you for every one of you. The advocacy and what we hear from you is so important as we look to passing this legislation and doing right by Indian country. So thank you.
Senator Smith.
Thank you so much, Chair Schatz. President Larson, welcome again. I'm so glad to be with you. Could you just explain to us, you think about these IRA corporate charters, I think sometimes it's hard for people to understand the real world implications for what these charters mean and how they end up constraining the lower Sioux. Could you just tell us a little bit more, like how does it make life more difficult exactly?
Well, thank you, Senator Smith, and I apologize. I forgot to thank you personally for championing this with.
You did it earlier this morning, so it's okay.
So thank you. The charter was not written with sovereignty in mind,
right?
Tribal sovereignty. It's actually an impediment to tribal sovereignty. Mm-hmm. The language that's restrictive and paternalistic, such as contracts cannot be made for more than 3 years at a time. If we want to borrow money over $1,000, we have to get approval from the federal government. So when we go to banks, mm-hmm. they don't want to deal with that. Mm-hmm. They don't want to work with us looking at that as a possibility. And also it has potential for exorbitant and egregious legal fees. Mm-hmm. So revoking the charter is, to us, a step towards self-governance.
It seems, even though you sort of put it to the side, you're not required to use it. It still constrains, for example, how banks might think about what you're working on. And correct. Of course, symbolically, it is a sign of that. As you know, we both use the word paternalistic in our discussion of it. So, I'm thinking about, there's so many great things that you all are doing. As you know, I'm very interested in the work that you're doing around building houses made out of hemp. And I wonder if you just might share a little bit about that project, and in mind, like how this revocation of the corporate charter would help you to do that work more efficiently and effectively.
Certainly. Senator, I thank you for bringing up that effort. The effort that we have to bring our citizens a safer, healthier, and more energy efficient home that could potentially last for generations.
Mm-hmm.
All the while it cleans the carbon out of the air, and while it's standing and lasting for generations, as I said, it continues to clean the carbon out of the air. We are currently building a hemp campus, which will house our processing equipment. Getting funding for that, people did look at that possibility. They said, well, what about this? We had to take more time to explain that the governance that we have does not use the corporate charter, but it's in people's minds. So if we could get rid of that, I think it would speed up the process for the things that we're trying to do in the future.
Thank you so much. I want to just take the opportunity, Chief Langford, while we have both of you on the panel, I'm wondering if you would just tell us a little bit about how the work that you all did with the revocation of your corporate charter and what that's meant for the Miami tribe.
Senator, I have to take a moment and thank you for your efforts to help this nation, as I want to thank Senator Mullins, then Congressman Mullins, for his help. Yes, everything he's saying, it's really hard for tribes at times. We have enough trouble with banks, being a sovereign nation, and we actually lost a bank. They got in there, they saw the corporate charter, and was like, what's this? And they just panicked. And so it's a real hindrance. It's an archaic thing, and I just have to thank you for helping tribes to remove that impediment that should never have been there in the first place. So, Missionewe.
Thank you so much. Thank you, Mr. Chair.
Thank you very much. I just have one question for the Assistant Secretary, Secretary Igorin. It's no secret that getting providers to serve in Indian country and Alaska, particularly in rural areas, is a tremendous challenge. So I support giving more flexibility to IHS to recruit and retain providers. What is HHS and HRSA doing to improve provider recruitment and retention in Native Hawaiian healthcare systems, which face similar challenges?
Thank you, Senator, for being able to talk about the work that HRSA does to oversee the Native Hawaiian Health Scholarship Program, which provides scholarships for 300 Hawaiians in primary and behavioral health disciplines. So it's working to expand the health workforce for Native Hawaiians. And those who have served, the majority continue to serve, once they go through this training, continue to serve medically high need areas in the populations within Hawaii. So it shows that the investments in having people serve in communities have people stay in communities.
Thanks very much. And could the tools proposed in S3022 be applicable to the Native Hawaiian healthcare systems?
Congressman, if it's okay with you, I want to go back
Senator,
to Senator, I'm sorry. I was a House mouse for a very long time.
I lost my House race. So.
Sorry, I apologize.
No, it's
years of trading. Senator, I would actually like to make sure that I go back to HRSA and get the correct information and have a technical conversation with your staff.
Okay, thank you very much. If there are no more questions for our witnesses, members may also submit follow-up questions for the record. The hearing record will be open for 2 weeks, and I want to thank all of the witnesses for their time and their testimony. I know how hard it is to get to Washington, and I really appreciate all of these tribal leaders and also administration officials for making the journey, and also the testifier online as well. So this hearing is adjourned.